Hi, this is Paul Palmer. So, have you ever considered what makes your business more efficient? I enjoy doing things that people often tell me are not possible. My name's Paul Palmer, and I've been in the pharmaceutical industry now for 35 years. And I enjoy systemizing businesses. What does that mean? Well, one of the tools that you use in quality assurance is process mapping. You can see one behind me. And really, it's about getting down to the basics. And what's the steps in the business? How do you make money? Where do you buy things from? How do you approve the suppliers before you even buy them? How do you choose what you're going to buy? How do you do your research? How do you register your license? What's all the different steps and the integration of them all? Now, I was told that I couldn't implement a quality management system from scratch in 6 months, but I didn't want to tell them that I did it in 3. And that was for a business that had never used a quality management system, and it wasn't pharmaceuticals. It was credit card personalization and phone card personalization and IP infrastructures, security infrastructure. Well, no, PK, not IP, PK infrastructure on the security side. And I implemented the quality management system, introduced specs for all the products, trained the team, the whole team, for the whole organization in rework, went over and did the root cause analysis in Germany, found the problem that was causing the cards to fail, even though it's a business I didn't know. I'm a scientist. I'm a biologist. I've been interested, I suppose, in understanding and fixing problems since I was, even before I did my degree. I used to do it when I was I want to say a teenager, but it's probably preteen, when I used to take things apart. And if they didn't go back together, well, get another one out of the box. And if they did go back together, so much the better. But maybe I just need to take it apart again to make sure it really was right and fix it. I built my first computer from pieces and it worked. I didn't even pay anything. Built a tower, with one of these tower systems with 3 hard drives. Of course, it had its own. I didn't do anything with the motherboard. That was working. Why change it? And I took the extra drives from 2 other computers that was being thrown away by the company I was working for. I thought, well, give me the pieces and I'll make my own. So I did. And I got 3 times the capacity of the computers they were using at work, at least storage capacity for the hard drives. But then I thought, well, if I can do that and I can build a computer, well, what else can I do? So I've made websites. I've done all sorts of things. I like automation. I like installing systems. I like training them out, rolling them out to people. I like reviewing existing systems and improving them. But it doesn't just apply to pharmaceuticals, does it? What business are you in that you could use a step-by-step process that people can follow to ensure that you maximize the efficiency in your business? In fact, is it just business? It could be your life. I actually recently have systemized the process that I have for starting my day, because why not? If it makes me more efficient and get to work faster, fit my time in for my personal life, the activities I like to do, as well as achieving everything I need to do, well, why not? And I can help you do the same, but you probably won't want to pay that much. So maybe I'll record something for you. But back to the point. Pharmaceutical manufacturers need a quality management system. They're required. And often they do it just to meet the regulatory requirements. But what if I can come in and help you with the oversight of your business, enhance the performance of the business? Would that be useful? So what I would do, I would start by getting an understanding of the quality management system. And then I would get an understanding of the way that the business itself runs as well, because it's not the same thing, rarely anyway. And then I'll align the two. I'll make sure that if there's steps and processes that just are there for the QMS that the business doesn't necessarily need, well, we'll look at how to make the business run the business, not the quality management system be an add-on. And by doing that, by reducing the add-ons, by eliminating the delays, by ensuring that the right people are doing the right job at the right time and meeting the regulatory requirements as well, then your performance will be enhanced, your costs will be down, and the efficiency of your business, which will be optimized. Maybe I'll get some help from your team and train them how to do it themselves going forward. Your performance, your delivery, your anticipated delivery time schedule. Well, contract review. Hope you've done that. Most pharma companies don't. It's an ISO requirement, isn't it? But you will be doing it if you work with my systems, because that's how you deliver in full, on time, every time. Because you know what you're doing and you've implemented the quality assurance systems and structures that are needed to give yourself confidence that you'll be able to deliver the product to the right spec, in the right time scale, to the right people, and preferably early. Because if possible, I always go early. I ran a project where we were looking at introducing a new product, but just because somebody said, oh, well, that's the time scale, I said, well, that's all right. We can still do it early. So we added an extra 150,000 to the beginning of the budget with the sales. Is that worth doing? Well, I think it is. I like doing faster. So I hope your team can keep up. And if you're interested in me helping you, send me a message here on LinkedIn. It's Paul Palmer. The company's Paul R. Palmer Limited. Just in case you can't find me, because I'm sharing the video somewhere else too. Okay, talk to you soon.